A special case was admitted to the hospital. A 20-year-old girl with epilepsy and slurred speech. She was supposed to be transferred to another hospital. However, due to a shortage of beds in the ward, she was admitted to this hospital. When the nurse examined the girl's body, she discovered a spore-like rash on her skin. Dr. Choi informed her that it was suspected to be Kaposi sarcoma. This is an early symptom of AIDS. They wanted to perform an HIV test on Abina, but the patient refused because she did not believe she had AIDS. The nurse patiently explained to Abina, AIDS is manageable. Antiretroviral therapy can prevent the virus from spreading. First, we must confirm whether Abina is infected with HIV, but the patient still refused the test. She still did not believe she had AIDS. After feedback from the authorities, Abina had visited other hospitals multiple times. The test results were all related to AIDS. She also had other health issues, pneumonia, meningitis, and candidiasis. A CT scan showed she had toxoplasmosis. One of the doctors suggested sending her back to the original hospital, because if they admitted this patient, she was likely to die there, because she refused all tests, and her condition was worsening. They could not change this outcome. Ms. Gwen suggested that since toxoplasmosis could cause intellectual disabilities, a psychiatrist could first try to change the patient's mindset. When Dr. Charles made the suggestion, the patient's aunt came to the hospital, but Abina only told her aunt that she had a cold. She just has a cold. Then the doctors began to discuss. The patient knew the hospital had a confidentiality policy, so the doctors were at a loss. But if they didn't treat her, the patient would have to take medication for life. Suddenly, Abina developed severe symptoms. She couldn't breathe. She coughed up blood. The nurses immediately put on protective gear. This was to prevent her from being infected. This action aroused the patient's aunt's suspicions. She asked Abina if she had a contagious disease. Just as Dr. Choi was about to reveal the truth, Ms. Gwen stopped him, because the hospital had a very important law, the Health Insurance Portability and Accountability Act. This act protects the health information of every patient. If a patient's privacy is compromised, the hospital and doctors could face litigation. But Dr. Choi believed that, if everyone had to follow the rules, patients might be abandoned. Later, Ms. Gwen found the patient, Abina. She came here to persuade the patient to undergo testing. Gwen told me many stories about the patients, but they had all passed away, and they were all HIV positive. Gwen could tell that Abina was afraid, but having AIDS is not shameful. But the girl couldn't move her heart. Finally, after Gwen's persuasion, the patient finally agreed to take the HIV test.